Thank you for coming out this morning and participating in this announcement. I appreciate you taking time. I want to let you know that on behalf of the Board of Directors and the executive team, we are very excited to announce a new development in the life of our organization. One Vision and Exceptional Persons Incorporated, based out of Waterloo, have entered into negotiations to see if it makes sense for our two nonprofit organizations to form an alliance. While it's too early to speculate on the final outcome, we have established a very positive working relationship, and a committee representing both organizations is working at exploring the various options available to us. A consultant has been engaged to advise and guide both boards and leadership teams through the discovery and the due diligence process. Since we are in the very early stages, there are still many questions to be answered. However, we want to make sure that you're aware of these discussions, share what we currently know about what this means, and make sure that you have an opportunity to ask questions now and at various points into the future. During the process, One Vision and Exceptional Persons Inc. are committed to maintaining our focus on our services, the individuals we support, our staff, and our valued stakeholders. One Vision and EPI were drawn together by our common vision of inclusion, our shared spirit of innovation, and our commitment to providing high-quality services to persons with intellectual and developmental disabilities. Funding pressures and expectations of managed care organizations are resulting in closures and mergers across the state. We enter into this partnership to find out how we can remain a viable provider in a competitive and changing environment. We are fortunate to have found a partner agency who similarly is financially sound and respected both locally and across the state. We believe our organization's strengths and needs mesh in a way that will allow us to respond to these challenges, be stronger together, to offer diverse services, and to grow. For the time being, our day-to-day work will not change. While we do anticipate changes as we adopt best practices from one another and look for ways to find efficiencies in our business practices, we want to assure you that we are not looking for efficiencies through position or staff reductions. Both organizations know that our employees are our most valuable resource, and we need every great employee that we have. In fact, both organizations know that we are understaffed, and therefore our work together will focus on how to better recruit and retain great employees. We also want to assure you that both EPI and OV are motivated to continue providing individual choice by providing services that lead to greater independence and purpose. A bit of evidence for this is that both agencies are working toward CQL accreditation. Our commitment to those we support, their families, and our staff will be evident in our move towards a partnership. Our relationship with EPI will continue to be defined over the next few months. Our respective boards and leadership teams are working closely together. By becoming a greater, stronger organization, we can more assuredly offer the stability that clients and staff desire now and into the future. We'll be working to regularly check in with you and to make sure that we keep you updated as we learn about what this means. A frequently asked questions sheet, FAQ, has been compiled to help address questions that people may have. It will be sent out via email as well as posted to our internet, and we have copies. Carol can point out where those are at that you can take away today, but we're happy to make some more if you would like. As always, reach out to your supervisor or to a member of the executive leadership team for questions. One last request, out of respect for families and guardians of those we support, we ask that you refrain from sharing this announcement on social media until 1 o'clock tomorrow afternoon. We have mailed a letter to families and guardians, and we want to ensure that they have time to receive that letter. We think that at the latest it will arrive in the morning's mail tomorrow morning. And so we're hoping that they can read that before it gets, broadcast out on social media. So with that is the formal announcement, and I'm very happy to entertain whatever questions that you might have and answer them to the best I can at this point in time. Cindy's got her microphone, so we can make sure you can be heard. But I'll make sure to repeat the question.
Can you talk a little bit about how large and what size EPI is at this point? They've been a recognized organization in the state for a long time, but I'm wondering how what their status is, how big their clientele is, etc.?
Sure. Thank you, Randy. So Randy's asking if I can share a little bit more about EPI. So one of the things I want to comment on is that One Vision and EPI have had a very long-standing partnership, especially at the executive level. They have an executive director who's been there for 25 years. He is familiar with and spent time talking with Gary Morosco when Gary was the CEO here. And then they worked together and spent a lot of time together when John Severson was the CEO, traveling to anchor conferences and even rooming, I guess, at times while they were out there. So the organizations know each other well, and as I shared, one of the things that really is attractive about talking more with them and finding a way to partner is that they just have shared values and commitment to doing things as we would think the right way. So EPI employs about 300 to 350 staff persons. They serve about that many individuals with intellectual developmental disabilities. However, if you look at their website, they will note that they have served about 3,200 people in the last year. And the reason is because they have taken over the contract for child care resource and referral services in the Mason City and Waterloo area. So similar to us, having a bit of a side venture, if you will, in certain areas, that is something that they took on. And so because of that contract and the fact that they're providing a referral service, that's what really elevates those numbers. But day-to-day operations, right in that 350 range.
So be one executive director over both organizations. Say it again. Will there be one executive director, or are we still in the process of looking for one?
So the board has suspended the search for right now. And really at this point, we don't know where it will lead to. It just depends on the type of partnership and how formally we bring the two organizations together. So it's certainly possible that there could be a separate but shared arrangement on things like electronic health aware software and those types of things, or all the way to a full integration of the two organizations. If it came to the full integration, then yes, there would be one CEO or executive director, and similarly other positions where we wouldn't have two of the same kind of thing. That's the kind of area, though, that we're talking about. So when we think about that and we think about integrating roles and positions, again, depending on how far this goes, we always know that's how people want to go to the very far end of things, and we're not ready to say that's where it's going to be, but regardless of how things shake out, there is a role for everyone in even a combined organization, right? There's enough work to be done, and we are lean in both places. So. Please don't be shy. I know there's lots of questions. And I hope you know by now I'll be as transparent and upfront with you as I can without getting too far out and making assumptions that we just aren't ready to make about things.
So you talked a little bit about they're based in Waterloo, but what's their footprint in the state of Iowa? Kind of like ours is spread out from Mason City and what other areas?
Sure, so Jennifer's asking how broadly spread out geographically is EPI. And other than the child care resource and referral in Mason City, they are concentrated in the Waterloo area. They, to the best of my knowledge, are not providing services in as geographically diverse locations as we are. Now, is it possible they're in a little community somewhere nearby Waterloo? I suppose. I don't know every single location, but it's not a lot. It's not 10 or 15 different communities like, well, I'm not all that familiar, but New Hartford or something, right, is down in that area, and some others. Yeah. So really concentrated in the Waterloo area. There are some, and so maybe along those lines, some of the things that we do that they don't do, they do not have any ICF facilities, although we do, but they still have some RCF facilities that they're running similar to us, and so they will be looking at how to integrate those clients out into the community the way we have, right? They'll be required to meet the characteristics rules. They bumped it back 3 years, so March of 2022, but that's still coming up fairly quickly. They do not have any thrift stores or other ancillary businesses, so that's something that we do that is a balance, or we would be bringing to the table. So again, they really don't have some of that alternative revenue that can come in and help support service operations the way we've been able to. With that said, that means they have run more in line with the revenue that they can generate just from services to balance their budgets. So they're a little more efficient in how they're able to structure and get paid, aligned mostly with just the staffing and the reimbursement for that. So they're excited about finding ways to generate additional revenue. Might there possibly be a thrift store in the Cedar Falls area? Sure. And that can happen regardless of what type of partnership we have. Maybe it's an untapped market for us, along the lines of a rag stockish kind of thing. So there have been lots of ideas that, when we've talked about the strengths that both organizations bring. But I want to.
I understand that both our facilities have similar interests, but how do we benefit from merging with them?
So again, I just want to make sure that while merger is one part of the conversation, it's not the only possibility, right? So I'm not saying it's absolutely going to happen to become merger. So there's really a couple of ways. The most immediate way is they have strengths in areas that we don't currently. So from an IT standpoint, you guys know that we have been talking about bringing SharePoint to the organization, getting off of Google Drive for, I don't know how long, 18 months, I think as long as I've been around now. They have a well-established system in that way. They can just easily expand and support us in some of our IT services. Now, that's not to say we would stop using NGT. It's just that they have strength to be able to scale that. They have a project management structure that we have been implementing as well. That's very effective. We can scale and bring some of their experience in that way. Long term, though, here's the bottom line, you guys, and this is really I'll try to keep it as simple as I can, just for time's sake. But I'm very happy to spend more time on this with you guys. So when we talk about managed care, both organizations, and again, I was going to emphasize just a moment ago, that both are financially sound. DPI is strong, they have a foundation, they have reserves, we are strong, we have reserves, so this is not something that either organization is choosing to do out of necessity in the immediate moment. Our current reimbursement system from Medicaid is what's called fee-for-service. If we provide a service, they pay us for it. Now, assuming it's been properly authorized and all of those kinds of things, right? And so when I say that happens regardless of the quality or the outcome of that service. Now, that's not a reflection on you. I'm just saying that's our system. Any provider that provides a service, if it's properly authorized, you get paid for it. What the managed care organizations are saying is that there's no risk to providers. All the risk is on the managed care organizations. If we don't do a good job and people get repeatedly hospitalized or have increased health problems or other needs, there's just more cost in the system. So they want to put more risk on providers. And that is called a value-based contracting kind of a reimbursement system. There are different levels of that. A middle level is that that we will get paid a certain amount, and then if we hit quality measures, we'll get the remainder of our rate. The very far end of that is called a capitated system. And what that means is, so it's essentially what the managed care organizations are under. We will get paid a flat rate for every person that we serve. There won't be tiers, right? And they'll cut it sort of right in the middle. And so we have to have enough people who we can serve for less than that amount to offset the people that it's going to cost us more to serve than we're going to get paid. That's where the risk comes for us. So thinking about partnering, how do we remain viable in this type of an environment? Both organizations, if there's no change to the reimbursement system, we will be able to be successful. We're currently successful, and we can be successful staying separate into the future. Even if we combined, and even if we combine all the way into one organization, because we're both independently successful, we're pretty confident we can be successful together under that fee-for-service model. If the managed care organizations go to a more risk-based reimbursement, value-based or capitated, we are anxious, nervous about our ability to have enough just sort of diversity, if you will, in terms of low need individuals and high need individuals to really be successful in that kind of an environment. So when we talk about pooling our resources and pooling our populations, depending on how we can do that, you don't have to have been a math major to understand the more people you have in a system, the greater diversity of need that you can have. So we believe that to be able to really be successful in that type of environment, we have to have a larger number of people that we serve, either in some combined way with two organizations that share that, or a single organization. So I'm sure that was confusing, but so when we talk about looking forward and how do we remain viable, that's what we're looking at. When we think about who would we want to partner with, that's when we look around at our options and look across the state and say, and it doesn't have to be within the state, but certainly for Iowa Medicaid, it needs to be in the state. Who is a similar organization, who has shared values, who do we feel we have a great relationship with? And in this case, that initial conversation was happening with EPI. And that's how we ended up in the conversations with EPI. But the conversations were going to happen, and they're happening all over the state. This will be big news, though, you guys. We are larger organizations than what you think of typically when you start talking partnerships and bringing organizations together, whether it's, again, just shared resources or fully bringing the two organizations together. So it will, we're just at that point. I hope, unless you're brand new to the organization, that this isn't the first time you've heard us say there are changes coming, and the changes have been started with just bringing in managed care to Iowa, and then the next phase will be finding other efficiencies and ways to work together collaboratively. So it feels like a somber mood in the room, and I certainly understand that. And one of the things I wanted to share is it isn't lost on me that I have been here 19 months, right? And many of you have been here 19 years and longer, and that I can't appreciate the amount of change that you guys have been through in the last 5 years. It's just not possible, right? And while you can rationally understand the need for it, it doesn't make it any less difficult emotionally and stressful in wondering, what does this mean? How is it going to look? How do we figure out the parts that don't work very well right out of the gate so that it's not worse for me in my life and in my job and for the people that we support than it is better? And those have been questions that you've been dealing with for 5 years or longer, depending on some of the changes. So with that said, we really do feel very positive about our conversations with BPI. We really feel like the organizations fit well together and can have very open conversations about what looks best, right? If it's some separate but shared arrangement or some fully combined arrangement.
Since they do not have ICS, what would happen to ours?
So Lori asked, since they don't have ICS, what would happen to ours? Well, we have an existing plan, which was in the works prior to these conversations, and we are committed to that plan, and that is continuing to move the ICFs into a more community-based settings. You know, and I'm going to kind of let Jane speak up, and maybe Cindy, if you want to walk around and make sure Jane has the microphone in case I misstate anything or excluding something. And so those changes were going forward for a couple of reasons. One is our campus redevelopment is driving that, and as well, there's a process called scenario-based strategic planning, and so you think of different possibilities, and you think about, well, if this happened, how would we respond, right? And that's kind of what we're talking about with the changes to reimbursement. I don't know if they're going to happen, but I'm 70% positive that in the next 3 years, those changes are going to start happening. Same with ICF. ICF may continue to be a service that is covered by Medicaid, and we don't know or not know. Currently it's not. We don't apply the characteristics of ICF. They could change their mind just like they changed their mind with other services, right? So we're trying to set it up so that we can have as flexible coverage and structure with our ICFs as possible. So we currently have plans for two pairs of 5-bed homes that we're working with the developer, and then we'll continue to assess our needs and continue on. It's also the case that there are a number of folks that are served in ICF that may be able to be served in the community. And currently with the tiers, there's maybe even a benefit to One Vision if we can find that out, as well as a benefit to the person served by having greater community base. So, did I answer your question, or did I go too far, or did I muddy the waters? A little bit. So please ask me, what didn't I clarify? We're committed to ICFs. I mean, as a service, it has its place.
I guess for me, I'm wondering the way they're classified. Does it need, or is that just going to be all also? Is that what you're saying?
Well, the ICFs, yeah, we just don't know. We want to we are committed to providing ICF services and believe that there is a place for that service in our service delivery system, right? The way we did with RCS, things could change and they could come in and say, sorry, we're gonna change the regulations a little bit and we're not sure. I mean, you can still do it, but you can't do it in that type of a setting, right? You can't in that many people all, and they may do the same thing with ICF. So we want to try and hedge our bets a little bit. But from an ICF level of care and need for nursing and all of those kinds of things, that won't change. And in fact, you know, as I talked about before, value-based contracting, they're focused a lot on medical care in the first place in terms of reducing costs to the healthcare system. So there's plenty of need for those services, nursing services, both at ICF and maybe more broadly still. So Diane asked if EPI has nursing services. I do not know. I do not know. Cindy, do you know if EPI has any nurses on staff? They don't have the type of nursing that we have because they don't have the ICS. But I would be shocked if they don't have some type of a RN or LPN or someone available to help with questions. they'll still have dietary needs in their RCFs and other kinds of things as well, right? So, and medication administration. So I have to believe that there's some type of nursing service that they offer. But we can get that clarified.
Limiting what they're going to be paying the company, would that mean they limit the how many staff could be at a house or at ICS?
Well, so Tyler asked, with my suggestion that in the future there's a potential that they would limit or they would capitate the rate, would it limit the number of staff that you have in a house? No, because there would still be costs that you have to stay within. And so it makes much more sense for us to, if we can find the staff to hire and retain, right? And that's part of our challenge in our situation right now, it's much better for us to have 2 or 3 staff at home to keep that person well and out in the community than to limit the staff person there and end up having higher costs because they're frequently going to the ER or something like that, right? And so that's what I mean when it's complicated, and I'll try and be as simple as I can, but in some ways, what it does is it gives us a little bit better flexibility, but it's not without its risks. I mean, that's the point. They want us to carry some risk. And so then we're responsible for saying, gosh, how many people do we need, not the CIS or whatever tells us that right now. These are really great questions, so, Greg.
Just curious, do they own properties? And if so, what type of properties do they own? Or do they rent? Or?
They do own some properties similar to us, although they have a few more RCFs. They own their RCFs. The total number, I don't know. I think it's in the neighborhood of about 40 properties that they own. And so, and then I'm sure that they also have some lease arrangements where, you know, they have clients in the location and then they just lease from the landlord. But they do own properties, and some of those will be 4 and 5 bedroom homes like ours, and some of them are some RCF settings. Yeah.
How is this going to affect the clients?
Well, our intention, Wendy asked, how is this going to affect the clients? So our intention is that in the period where we're exploring what option makes more sense, that it really doesn't have any impact at all, and in some ways that you guys aren't even aware of what these conversations are. Now, that doesn't mean we don't want your input on, if we were to do this, how would it work, right? But from a day-to-day standpoint, we really don't want it to have any impact on our clients. And we really want to align this with the direction that we're already going. We want to find a way to have better person-centered services through CQL, find a way to better staff all of our locations so people can get out into activities, right? We are struggling. I mean, there is no question we are struggling with that right at the moment. And so, but it's not as though we're going to somehow say, okay, we need this number of people to commute down to Waterloo and help cover down there, right? And leave some of our folks up here short, or vice versa. It's intended to say if we can pool resources and we, you know, again, if we're paying less for some of the shared software platforms, like we use CDS, right? We have a cost for CDS, we have a cost for our accounting software, we have a cost for our electronic health record, we have a cost for all of those kinds of things. We have a cost for our healthcare benefit management, on and on and on. If we can reduce those costs, if we're sharing those things, then we can come over here and say, let's, you know, find a way to, you know, increase wages or increase benefits or find some balance for that. So I say that, I'm still talking about staff, but it is about the staff and take care of the people that we support, right? So committed to person-centered care, committed to getting the right number of people out there that allows people to get out of the community. But really, we do that through taking care of the staff and trying to find a way to have better benefits and pay better and all of that. And I know it probably sounds like hot air right now, given where we're at. But we are committed to that. So I think just yesterday or the day before, Carol sent out an email. It was a follow-up to my message about staffing that I had sent out. That listed all of the executive team and their emails. As well, I hope you know your supervisor's email and phone number and office location. And so please don't hesitate to reach out with questions. If you feel comfortable asking those questions here, send those messages or those questions to us, right? We want to answer whatever questions that you have. We want to assure you that we are not entering into this arrangement believing that we're forced to have to do this, or it's going to cost we have to reduce the services or the staffing or anything of those sort. It is not that at all. We want all of you engaged. We want all of you to tell your friends to come work for us. We want to keep moving forward and create the best opportunity we can for the people we serve.